Our presentation for today is titled Strategies to Help Teams Sustain the Implementation of Best Practice Guidelines in Their Organization. And it is with great pleasure that I introduce to you our speaker for today. May Tao is the Health Promotion Specialist at Toronto Public Health, and she's currently coordinating the RNAO Best Practice Initiative to implement and evaluate best practice guidelines in her organization. She's also the lead of divisional orientation for new staff and students in the organization. May has a bachelor's degree in nursing and a master's of science in nursing. She's also certified in community health nursing with the Canadian Nursing Association. She has a strong interest in evidence-informed practice, knowledge translation, and effective strategies for guideline implementation. May has been participating in RNAO's Advanced Clinical Practice Fellowship, building on leadership and youth engagement practice. She has also volunteered as an executive member of the Registered Nurses Foundation of Ontario and an active member of CCHN Leadership Standing Committee. She has coordinated medical teams to work with local communities in several countries such as Belize, Greece, Ghana, and Uganda. Her vision is to empower others to reach their potential, strive for excellence in public health practice, and inspire organizations toward continuous quality improvement. It is with great pleasure that I welcome to you today, May Tao.
Thank you, Macy. Good morning, everyone. This is May. And again, this presentation is about strategy to help teams sustain the implementation of best practice guideline in their organization. So our agenda today is to provide you a description of the BPSO journey at Toronto Public Health. Want to define sustainability to you and its importance. And then finally, some practical strategies to maintain and sustain your BPG implementation. So hopefully that after the presentation, you will gain a better knowledge or an understanding of what sustainability is and its importance, and identify some practical strategies again to sustain a new or existing BPG implementation. So just to give you a very brief overview of Toronto Public Health. Toronto Public Health is the largest public health unit in Canada, responsible for the health and well-being of all 2.9 million residents and 1.4 million people who work in the city every year. And TPH is the fourth largest public health unit in North America and has focused on protecting and promoting the health of Toronto residents since 1883. And our mandate is to reduce health inequities and improve the health of the whole population. So now I want to give you an overview of TPH BPSO journey. We started as a BPSO pre-designate in 2009 to implement and evaluate at that time 5 BPGs from the RNAO. And of course, the purpose of this initiative is to systematically integrate the guidelines into practice across the organization. Well, we received our designation in 2012, and now this is our 10th year being a designate. We started with 5 BPGs, and this has grown to 16 guidelines implementation with the 17 in the wind. And each of the BPG initiative has a planning team, a group of champions to help the implementation. And right now we are nearly having 500 champions at TPH. Our motto, the way that we are actually doing our BPG is to start small, but think big. Each BPG initiative starts with a very small implementation of the evidence-based recommendation, followed by extensive evaluation and refinement prior to roll out across the division. So now it's your turn. It's your turn to actually define what does sustainability means to you. So I would like you to actually put your definition in the chat box. In the chat box, what does sustainability mean to you? If you can take a minute, just put down your answer in the chat box, that would be great.
Please remember to select all panelists and attendees when you're typing your question in the chat box so we can all see your information that you're typing about your definition. If you can share that with all panelists and attendees, your definition of sustainability, what it means to you.
I can just tell you why I put that picture of plants there. Tell you a little bit about this. And I said, just like a young plant, when you planted it in the pot, you know, how would you sustain this plant and keep it going? Well, I have to tell you, my late mom is a green thumb, and unlike my mom, I am a brown thumb. Everybody that has a plant that I touch, I will kill them for sure. But my mom has a green thumb, and she would tell you that how she sustained the plant is by watering them, providing them sunshine and fertilizers. So sometimes I even saw her talking to the plants. So here it is. There's some answers. Yeah, let's see some of the answers. Continue. Oh, I have to roll it back out. Oh my goodness, you guys got it. Yeah. So long lasting meaning means that it incorporated into everyday's practice. Right on. Continuity. Using the minimum resources needed. Oh, I hope so. I hope we would do that. To keep our work moving forward. Yes, definitely. Changing culture, behavior for the long term. Yes, since something that will continue to and be function. Yes, ongoing continuity. Good job. Good job. New practice becoming a second nature. Yes, definitely a public health. This is a public health model kind of thing. Become a second nature. Ongoing implementation and support in organizations and cultural changes. Great. Oh my goodness. Thank you so much. Yeah. I'm going to actually tell you the next slide, and it's about sustainability. Ooh, I have to go back again. All right. So yeah, you got it. Sustainability means that when a new way of working, you know, for example, a new way to integrate evidence into your practice, a guideline into your practice, and the improved outcome are maintained and become the norm. Somebody said that the second nature of the organization. So this means that the practice, as you said, will continue the continuity without any external funding. No funding, it still continue. And as well, the practice can continue to achieve the same benefit as in the pilot stage for the client and staff members. Also means that the practice will continue even in the absence of the original team who introduced it. And I must tell you this, in TPH, most of our original teams, which is like, you know, almost 10 years ago, who introduced it, were not there anymore. They were not there anymore. So, but the BPSO initiative is still alive in our organization, and it's still sustained in our organization. So yeah, you got it right for the definition. So next thing I want to talk to you about is why is it important to sustain an implementation or a policy? Why is it important, sustainability? So if you want to foster the continuation of the practice change, then you will need to ensure long-term impact of the improvement efforts. We also want to ensure to yield desired health outcome for your clients. And that's the second reason. Third reason is we want to maintain financial and human resources for the implementation. And so without a sustainability plan, significant investment of human and financial resources will be wasted in the implementation of your guideline or your policy. The third reason, or the last reason, is that staff and clients will be confident and enthusiastic to engage in the implementation when the change initiative continues. And furthermore, understanding how to sustain and incorporate this new form of knowledge into practice is one of the critical components of BPSO in implementation. So now in the following few slides, I'm going to use the word sustain to illustrate some strategy or several strategies for you to sustain your BPG implementation. So the first letter is, of course, S. S means that it's support from your organizational leaders and relevant key stakeholders, such as the RNAO and leaders of the program in your organizations. Well, it is extremely important to have support from your senior management team for your BPG implementation. Now, I'll give you a few examples. An example. We have implemented the workplace health, safety, and well-being of the nurses BPG since last year. And this is our second year implementing this BPG. So before we start to implement this BPG, we conducted a survey for our staff in terms of wellness health. And in that survey, the staff have identified their needs specifically to stress management, rest, and relaxation. So as a result, since 2021, last year, TPH has launched a holistic wellness program to encourage the staff to integrate health and wellness into their daily practice. And this wellness program has tremendous support from our senior management teams. And one of the success wellness activity last year is called the Physical Activity Challenge, where staff are encouraged to walk 10,000 steps every day for a month. And yes, last year, over 500 staff participate in this challenge. So this year, what we did is we extended this challenge into 2 months. So even the senior leaders in my organization participate in this challenge. And actually, we just started this challenge on Monday, and we're going to embark it, for this 2 month. I think July, August, and middle of September. So that's 2 months. The success of implementing this BPG is to have the support and funding from the senior leadership team. So now next one is you. That's next strategy. You means you need to continue to engage your staff. Well, TPH used the champion model as an effective strategy to integrate evidence, which is the guideline, into practice. We have now nearly 500 champions. We use different strategies to engage our champions. So for example, before COVID, as you see, we held an annual champion development forum for our champions. As well, we provided an incentive to thank them. And each year, we celebrate the success of our champion in this event. And one year, we gave them a book about leadership. As well, prior to COVID, we organized a BPG learning cafe to update our staff what happened with different BPGs at TPH. In addition, we provided workshop for new champions 3 to 4 times a year. We also developed a champion recruitment package. So whenever we have any event in our organization, we are ready to recruit more BPG champions. For the workplace health, safety, and well-being of the nurse BPG, we have over 90 champions to assist implementing the BPG. Some of the champions belong to a committee to help planning the monthly activities, and some others assist to engage their team to participate into the activity. They act as the cheerleaders of their team. So next slide I would like to ask you some of the strategy that you use to engage your champions. So please put down some of the strategy couple of them or one or two of them that you use to engage your champion in the chat box. Huddle. Oh, love you to talk about huddle. Type out, if you can, what huddle means to you. Lawrence. Unit huddle with treats. Oh my goodness, I love that. With treats incentive to join, like a gift certificates. Ah, cool. Awesome. Email, personal interaction, assign tasks. Ah, yes. Give opportunities to present or lead the project for the team. Excellent. Yes. Recognition. Oh, very important. Recognition, appreciation. That's what actually we have this annual champion development events every year prior to COVID. Yeah, annual Champions Day is held. Oh, excellent. Love you to share more about that. Yeah, that's great. Okay, let's go on. Because of the time, let's go on. Oh, couple more, sorry. One more new message. Let me have a look at that. One more. Picnic. Oh my goodness, I love that. Maybe I will suggest to my chief nurse. Annual picnic event with incentive. Great idea. Thank you. Thank you. Thank you, everyone. So let me go on to next slide, if I can. Next slide. Good. Thank you. Thank you, Andrea. Next slide is it's the word S again. Sustain. S again. So what does the S stand for? S stand for sharing your BPSO experience with your staff and other relevant key stakeholders, such as through workshops like this workshop, at conferences and publications. TPH attended conferences locally, provincially, nationally, and even internationally. Actually, I did the presentation in China since it became a BPSO designate in 2012. We have also written several publications. Currently, we completed a manuscript on our overall evaluation of BPSO and how the initiative has impacted to our organization, and submitted this manuscript to a publisher. And hopefully that we will actually publish these articles. So the next letter is T. T stand for to weave evidence-based practice into your organizational culture and become a norm to integrate evidence into practice and decision-making process. So for the last 10 years, evidence-based practice has woven into the fabric of our daily practice at TPH. We use evidence to inform our practice and decision-making in our programs and services that we delivered to our population in Toronto. We also integrated the use of evidence into our strategic plan and even developed performance measures. Next letter is A. And what do A stand for? A stand for adapt the BPG implementation to fit with your organization needs and current situation. So for example, we are implementing the Person and Family-Centered Care BPG. The original goal of this BPG is to address vaccine hesitancy in the prenatal population by including evidence-informed immunization education and strategies and content into an online prenatal program. And with the current COVID situation, of encouraging population in Toronto to get the COVID vaccine, so instead of targeting only the prenatal population on vaccine hesitancy, we expand the BPG to all Toronto residents by including the evidence-informed immunization education strategies and content in our city website. This is one example to adapt your BPG implementation to fit the organization needs and current situations. So now, next letter is L. Actually, it's I, sorry, it's I. And I stands for increase the number of champions in your network. And for example, through expanding the BPG implementation. So TPH has grown from 90 champions in 2009 to now, I said before, near 500 champions. And even during COVID pandemic, I have been speaking about the BPSO initiative to any new staff joining TPH. Recruitment is definitely a strategy. So it's an ongoing process. So you need to prepare an elevator speech about the BPSO initiative. So wherever you are ready to speak about BPSO to your staff and key stakeholders. I can tell you a story about this. I have a new staff like a few years ago now, a new staff actually joined TPH. And we both actually was in the elevator trying to actually go down, go down to get a coffee in the morning. And so I think it's a second floor in one of our offices. It's a second floor of the public health is in the second floor. So we were going down to almost to the lower ground to actually get to get a coffee. So from second floor all the way to the lower ground, I managed in these few steps or few floor, I managed to actually talk to him about BPSO. And eventually he joined to become a champion. And actually, not only that, he helped us to implement the tobacco cessation guidelines. He also actually grow in his leadership skill, and actually went through his master and actually get promotion last year. So this is a wonderful story to share with you. So next letter is about N. It's actually the last letter now because it's a staying. It's about N. N stand for, what does it stand for? Need to continue to monitor and evaluate the effectiveness of BPG implementation. And so as I said before, at TPH, all aspects of the BPG implementation are evaluated. Some of the project has been full research initiatives, other have little e, other are little e evaluations. But in all cases, there has been tremendous learning along the way. And along with this, we also conduct an overall evaluation of the impact of BPSO on our organization as a whole and find amazing results. We evaluated the impact on the use of the evidence by our champions, the level of collaboration in the BPG implementation, and the BPG sustainability. And I would also recommend you to evaluate the overall impact of BPSO on your organizations. The other example I want to provide you is that we implemented also the breastfeeding BPG. So during COVID-19 pandemic, we have shifted our in-person visit to an online support to the clients, breastfeeding support to our clients. We conducted a customer satisfaction survey to evaluate the effectiveness of this virtual breastfeeding service to determine if this online format met the client's needs. Very positive feedback was shown in the survey. Overall, the 94% respondents expressed that they would highly recommend this form of service to others. So that concluded the strategies, and I would like to share an excellent resource that I actually used to prepare this presentation. It is called Leading Change Toolkit by the RNAO. This resource was produced in partnership between the RNAO and the Healthcare Excellence Canada. And I'm one of the panelists. I am one of the expert panels to assist developing this resource. This resource helped change agents and change team like the BPSO team to make lasting and successful improvement in healthcare. And the toolkit is online and it's open access for everyone to access. And it's focused on the uptake and sustainability of the evidence using two framework. One of them, I hope you already know, is called the KTA framework, Knowledge to Action Framework. And the other is called the Social Movement Action Framework. And it is about a collection of core elements, such as a collective identity that deplete a social movement in the context of using evidence to create a lasting change. So BPSO itself is that collective identity around the world to integrate evidence into practice. So I highly recommend you to use these resources. And after you use these resources, give your feedback to the RNAO. So thank you, everyone. And this actually concludes my presentation. And now actually I'm open up to everyone to questions. And you can actually either type your question in the chat box, or you can actually open your mic and actually talk about it and tell me about your questions.
Thank you so much, May. This was really a brilliant presentation. I know for myself, I have a few takeaways of what you mentioned. I really love how you said start small, but think big.
Right.
In terms of the impact that you want to have with the changes that are being made, and also, change becoming the norm, right? And and it continues even in the absence of the original people who might have started the change initiative. So those are some key things that really stood out to me as you were speaking about, just sustainability. And I really love how you use the word sustain to break down some strategies of what we can do as whether we're BPSO leads or we're champions in our organization, or we're just looking to implement change or through our best practice guidelines.
Right.
It was really, really concise and really some effective strategies that we can use to do so. So thank you so much for that presentation. So the chat box is open to anyone who has a question for me that would like to ask. If you're comfortable and you would like to speak with us, you can use the raise hand feature in Zoom, and we'll allow you to unmute your lines and share. I see we also have an individual joining us from the University of the West Indies. So great to see you here and to see that you're introduced to this program.
Welcome. We speak to each other before the West Indies, during the Knowledge Exchange Forum when we're in person. few years ago now.
So I see some questions coming in. So in terms of leaders looking to implement BPGs within their organization, how do we approach resistance to change from staff? And how can we create change if everyone on the team on a specific unit is resistant to it?
Oh, good question. Good question. This is talking about the resistance. And what I can actually tell you is that you actually try multiple strategy, trying to engage your champion or engage your staff. They are your important resources for the guideline implementation. The other thing is, as I said before, it's really important to engage your senior leadership and senior management team. Once you engage them, then actually not the top down, but they would actually acknowledge that we are BPSO organization, and this is what we're going to do. Resistance takes time. Don't forget that, and normalization also takes time. And if you actually approach something like you approach the majority, the 64%, the middle of the curve, and actually actually start implementing the implementation. At the same time, listen to the people that are resisting the change, and listen to them. Then actually the result will be like you will change that them to become the 64%. Now it becomes 65%. Some of the resistance of like the BPSO to actually implementing the guideline is time, not enough time and not enough resources. And what you need to do is, again, the senior leadership is to actually ask them for time and ask them for resources for the champions and for the staff. And every year, actually, before COVID, we actually approach our senior leadership team to talk about to give them an update of BPSO. And at the same time, sometimes we actually even approach our board of health committees, which is in the city, to actually talk to them about BPSO, let them acknowledge that this is a great initiative because we integrate evidence to actually for practice change and to sustain it as well.
So thank you so much, May. There's another question here. How have organizations been able to continue and engage and educate staff during COVID when staffing is short and resources are quite limited?
Well, you know what? I'm going to use the word passion to illustrate this answer, to tell you this answer. How do we do that? Problem in like the P is the problem in practice solving systematically. And so if you're actually doing this systematically, you need the passion for doing that. And you also need small success, like you achieve small success if you actually can using small success. For example, we let the staff know that we actually just submitted the manuscript to a public publisher. It's a small success during during COVID time, and it's very hard during COVID time to ask for staffing. But the resources are limited. We concentrate on what we can do. And the other thing that I actually mentioned in my presentation is adapt the BPG implementation to the COVID situation. And that's what we did with the person and family centered BPG. Instead of actually doing it just for the prenatal population, we actually adopted the BPG into TPH, into the whole Toronto residents. And so always like look at that, to adapt the BPG, into the organization needs and the cultures. The other thing that I could tell you is that before we look at this as a quality improvement, we look at this as a quality improvement approach. And so this is how we still maintain our service delivery. And our BPG since it's embedded into the practice, for example, breastfeeding, and we still can integrate that into the practice.
Awesome. I really love, that you're really taking time to celebrate those small wins, and it really encourages the staff to keep going,
Keep going. That's right.
Yes.
Actually, encourage myself to keep going. Yeah, exactly.
Yeah.
Keep going. The small step is really important. Look at the small step. Even with the workplace safety BPG, and we actually look at the first step. There's only about 2 staff at the beginning looking at this BPG, 2 of them, and me, I guess, and the 3 of us. And so now it's expanded to 90s champions. That's actually took 2 years. So look at that. We actually doing that program at 3 of us, at the beginning, and now it actually the second year we actually have more champions to join. So yeah.
Excellent. We have a question here also about what would be the best way or the most sustainable way to address the staffing issue within the healthcare system, like what we're seeing currently. Any recommendation?
Yeah, in TPH, actually, we have staff that are still maintained in that critical public health service. So we still have staff maintaining that, where most of us actually gone into the COVID to maintain the COVID-19 the pandemic. However, it's that group of critical care staff that we actually still we actually practicing the BPSO. Now, actually, the COVID staff, we do that too. For example, we are delivering, COVID-19, information to our school population, and we use, we have actually the staff to actually engage, to teach them how to engage youth and engage the staff in the school health program. So wherever you can put the BPSO in your BPG into the practice, whether it's COVID or whether it's actually whether it's COVID pandemic, or whether it's actually the less lack of staff and resources, you can actually tap into that. You tap into what you have, and you keep pushing it, going for that, moving forward of that.
Excellent. And May, I was just wondering, what keeps your passion going for BPSO and integrating evidence-based practice?
Well, I think that's what I was going to use, a passion word for that. And one of them is that, what I like BPSO is because it actually solves problems, in practice, solving it systematically, like step by step. And so we used to have no policy in youth engagement. Everybody's engaging youth in a different, it's not consistent. But because of BPSO, we actually now are coordinated and actually really consistent engaging youth, because we created a policy because of BPSO. We also achieved the excellence in service. A is excellence in service delivery in quality improvement approach. So everything we evaluate, and then we actually make make a quality improvement plan to improve it. So it's sort of part of the sustainability. The S is actually we successfully eliminate the use of intervention not recognized as best practice or integrated evidence into our practice. So something that we used to before, now we don't do that before. I have to tell you a story that I implemented. Like, I was also mentoring the staff in China, and one of the old practice in China is that they don't cut. They actually they actually cut their umbilical. I guess not cut. They actually when cut the umbilical cord when they actually having delivery. So there's many old practice that in China that they do it. But because of the BPSO, they now actually doing evidence-based practice. Like everything has to be evidence. Used to be that I would have experience, oh, this is my experience, I would do that. But now they actually use evidence to do that. The S is to sustain the guideline implementation and normalize it as part of the practice. So that is actually, when you sustain it and when you see the result, this is our 10th year already being a BPSO. When you see the sustainability, how it sustained it, the fires keep going. But you have to start your fire first. You start your fire and you actually, giving that to your staff. When people see me at the beginning, you actually have to create this sustainability. You put everything in your board, your desk. You almost want to put BPSO on your head, but when they see you, they know that it's May coming, and she'll talk about BPSO, and it's sort of, they know about that. But fire, starting the passion, having the passion is important. The other one is it's sustaining so that's about it. So sustaining the guideline implementation, normalize it as part of the practice.
Excellent. Well, thank you so much, May, for this presentation. It's really been an engaging discussion today. And as we prepare to wrap up today's webinar, I would like to thank everyone for taking the time out of your day to join us on this webinar. For those of you who are participating in the live webinar today, you will soon receive a link to an online survey to evaluate today's presentation. And after you've done the evaluation, you will receive a certificate of attendance. In addition, if you can please let us know of any topics that you're interested in learning about. We would definitely love to know about any topics you're interested in. And lastly, I just want to let everyone know that this work is funded by the government of Ontario. So again, everyone on the line today, we thank you so much for joining us. We hope that you enjoy the rest of your day. And thank you again, May.
Thank you.